Well, good morning, everybody, and welcome to the session this morning on measuring the impact of CDCs. This session is a bit of a companion piece to the earlier session we had this morning. Just by way of show of hands, how many of you were in the earlier session? Okay, excellent, because it looked like there was a lot of questions and comments kind of waiting to come forward, and hopefully we'll have a chance to pick up a number of those. I'm Brad Whitehead. I'm president of the Fund for Our Economic Future in Northeast Ohio, and I'd like to begin with a little bit of a confession. And the confession is that I don't work in the world of CDCs, and when I was approached about moderating this panel, I tried to turn it down about 5 times because I said, what could I possibly have to bring to a session of this sort, and frankly, I'm really thin on the content, and I'll be exposed for that thinness in the content. But then as I reflected more in the theme of this, because what I do at the Fund for Economic Future, we're a collaboration of the funding community in Northeast Ohio, where we're working on a long-term economic plan, regional economic plan, to turn around the economy. And so I spend most of my days working on new industry clusters, fomenting tech-based entrepreneurship, and figuring out how we can promote business expansion from some of our most important employers and things of that sort. And so you can see that on one level it feels far afield from the world of CDCs. But on the other hand, the theme of this conference, Bridging Growth and Opportunity, perhaps makes it very sensible for someone like me to be facilitating a conversation of our experts and all of you, because it is bridging growth and opportunity. And it struck me there may be at least 3 reasons why it's of interest. The first is this idea of growth and opportunity, and I don't know what it's like in your geographies, but in our geography, often we have our growth world over here and our opportunity world over here, when in fact they're 2 sides of the same coin, and what we need to be thinking about is not a growth camp of those people working on those growth things, in the opportunity camp of those people working on economic justice issues, but we need a third camp where we have growth and opportunity working with each other. Secondly, is this idea of regional and local. I work at a regional level, and so much of the CDC work occurs locally. But I was very much struck by the comments of Bob Weisbord, who does some work with the Brookings Institution, who made the comment that neighborhoods don't have economies. Neighborhoods don't have economies. Neighborhoods have assets. And so a big priority for us in our organization right now is how do we connect the regional assets, the regional economy to the local assets. And the third thing that is interesting, at least to me, is that I know that when we're working on regional economic development, we want to be data focused, we want to be metrics based, but we're finding it really, really hard to do because everything is connected to everything, and it's really difficult to even know what the goal should be. So here we are today to talk about all of this, and we're going to do it in the context of, well, what does that mean for the CDCs in the brave new world of the future that we discussed this morning? But before getting in, I'd just be curious, and I think our panel would like to know as well, in terms of who's in the room, who's in the room today. And so I'd just be curious, by a show of hands, how many people are our Federal Reserve banker friends in the room? Okay, so we got a good group of those. And how about those of you that are CDC professionals? Okay, so we got another maybe 1/4 of the group there. How about economic growth professionals? Woohoo! Okay, yeah. All right, we're there. Universities. We have a university here as well. Public officials. A couple of a public official, so you can speak on behalf of them. How about funders? Okay, and a big slug of funders. And is there a species that we left out? Yes? CDFIs, thank you very much. Any other CDFIs? Okay. Excellent. So we got a good mix in the audience here, and I hope that means that you'll be channeling your inner skeptic and your inner cheerleader about what we hear, because we're going to really want to pull you into a lot of this. So this morning, a couple of themes that came out, and I won't go through them in detail, but at least a couple of the big themes that seem to come up that I think bear important relevance to this conversation about how do we think about impact. I wrote down 6. The first is there was quite some conversation about what is even the goal of our CDC communities kind of in this brave new world that we face. And we had the example of if we were designing a housing system to meet the needs of the community, we might be doing something different than many of our CDCs are doing today. So this first question we explored this morning was around goals. The second one was even just a question about, well, what does it mean to be relevant as a CDC today, and how do we confront the stereotypes that the CDC is a construct and artifice of the past? Third, the point was raised that there is an inherent tension between what is perceived to be needed, which is a comprehensive collective impact approach that touches upon multiple dimensions, and what seems to be the desire of funders and the sense of impact of focusing in on a silo, something that you can do and measure, and so this tension between the broad and the narrow. Next up was the thought of then saying that we need to be in control of a narrative. And I thought the quote that struck me was an interesting one. It said, data without a narrative is meaningless. And so how do we construct a narrative? And then from there, as we're constructing a narrative, then it's a question of says who? Whose narrative is that? For whom is that narrative? And then that implies this question of, well, who's at the table and what does this mean in terms of the partnerships that we have? So if you missed this morning, at least that was my take on it. You may have had some other takes, but that'll be our point of departure here. And with that, I'd like to turn then to our panel, who can guide us through this journey of how we think about impact. And it did strike me that, we all, at one level, the idea of measuring impact and metrics seems platitudinous because we all pray to the God of measurement. I mean, what's not to like about it? And it's going to be up to us to try to push this down a layer in the conversation. But it is tricky because, like all gods, it can be tricky in the sense that a God can be hidden and elusive, and so that the data that we're looking for and what we should measure may not be what we see on face value. As we know, a God needs to be ecumenical in that it needs to speak to all its adherents, not to just those within the chosen faith. So how do we have a metric and a set of measures that appeal to a broader community? Walter, something you talked about this morning. And as we know that a God can induce zealotry and intolerance, which can lead to bad outcomes. And so if we adhere too faithfully to the metrics, will we lose something in the process? Will we lose flexibility and the ability to be creative, to take risks and respond? And so while I believe religion is a good thing, we need to be eyes open as we head and pray to this God of measurement. So with that, let me introduce our panel. And what we're going to do, the way the session is going to unfold, is we're going to briefly ask the panelists to introduce themselves. And then we'll work our way through 4 questions. The first is, when we're thinking about impact, what is the ideal state? And Maggie Grieve from NeighborWorks will be setting forth a possible framework there to which our panelists will respond. Then we'll mix it up and have you kind of push on that a bit. Then we'll move to, well, what are the gives and gets with that ideal state? Then we'll have a little bit of a conversation about what stands in the way of that. And then we'll wrap up by talking about some practical steps that we can follow. The only ground rules we have is that we'll take interruptions as we go and try to engage in it. And then, again, this just requests that we push hard and get ourselves past the level of the platitudinous. So with that, let me turn it over to each of our panelists. who can hopefully introduce ourselves. Denise, we'll start with you. Oh, by the way, this panel is great because we have a funder, a CDC association, and then somebody who's working in the measurement and impact field. So first up is Denise Armbrister, McGregor Armbrister from the Wells Fargo Regional Foundation, our funder.
Yes, and thank you, Brad, and good morning, everyone. And also a shout out to the Fed for having this session. I think it's very important, and I'm glad to be part of it. I have the pleasure and the privilege of serving as the executive director of the Wells Fargo Regional Foundation. And the Wells Fargo Regional Foundation's mission is to improve the lives of children and families living in eastern Pennsylvania, New Jersey, and Delaware. And our focus is on comprehensive neighborhood revitalization in low-income communities. Now, our resources go, really predominantly to support CDCs, CBOs, and other nonprofits which are rooted in the communities in the creation and implementation of, again, comprehensive resident-driven neighborhood plans. Now, these plans are not only focused on improving the physical, but also on the human capital. And I guess from our earlier session, they're really, I would say, on the demand-supply side. As you can well imagine, the neighborhood revitalization in these communities cannot be achieved overnight. And so our support goes for supporting this work in the communities for up to 10 years. And in addition, we also see ourselves as a learning organization. So the foundation has developed a theory of change, which we do share with our grantees, which we use to help to evaluate our work. And then we also develop an in-depth evaluation framework with our grantees and in those communities, and we support that work with the utilizing technical assistance from NeighborWorks America and their success measures, which you'll hear about, and the reinvestment fund, as well as community wealth ventures or partners in Washington, D.C.
Great, thank you, Denise. We also have on our panel Rick Sauer, who is the executive director of the Philadelphia CDC Association. So Rick, over to you.
Great. Good morning, everyone. Glad you could join us. So as mentioned, we are a membership organization of about 100 community groups and a range of, not just CDCs, but a range of other organizations that are engaged in advancing equitable neighborhood revitalization and addressing the needs of lower income neighborhood residents. And while we're not a direct practitioner in that we're not building housing or doing housing counseling or revitalizing neighborhood commercial corridors, we're there to increase the capacity of our member organizations to carry out that work. And we tend to do that through sort of two buckets of services. One is policy and advocacy, both expanding local resources to support that work. So, for example, we got a housing trust fund created several years ago that's raised about $95 million here for housing locally, a local tax credit program. And then on the flip side, sort of the improving systems, the community development systems that folks use here. So whether it's the recent approval of the Philadelphia Land Bank, which we're now actively engaged in making sure it's becomes implemented effectively, or a couple years ago, a big effort to get a new zoning code in place, which was the first time in about 50 years that had happened. So that's on the policy front. And then on the member services front, it's more working to build the capacity of groups through training, technical assistance, trying to provide some thought leadership through our Philadelphia Community Development Leadership Institute that we just launched last year. And we also do a fair amount to sort of convene members around key issues, but also promote the good work that's going on in the field. And one of the things we did just recently, if you go to the next slide, was about a year and a half ago released a report called Collective Strength. And so we're here today to talk mostly about how you measure the impact of an individual organization. But what we wanted to do was sort of try to create that narrative a bit around what the impact is of the broader industry here in Philadelphia over the last couple of decades. And so we worked with eConsult Solutions to analyze some data, put out a report that lo and behold found out that CDCs had more than a $3.3 billion local economic impact. And if you look statewide, it's been over $5 billion, tens of thousands of jobs created, substantial increase in homeowner wealth by addressing problem properties or vacant properties, and substantial tax revenue to the local and state government as well.
Great, thank you. So I guess on the question of relevance of CDDs, your comment is so there.
Right.
And then third up, and getting us going in the conversation and putting the model out there, we have Maggie Grieve, who is the VP of Success Measures at NeighborWorks, which has been working with hundreds of organizations to think about this question of impact in our CDCs. So Maggie, why don't I turn it over to you to introduce yourself, and then we'll let you just flow right into the model. Does that sound okay?
Okay, sure.
Good.
Sure. Good morning, everyone. My organization, Success Measures, helps organizations throughout the community development field measure the impact of their work. And we work with community-based nonprofits.
You want to go over?
Yeah. Okay. We work with community-based nonprofits. Here, let me put this back. Funders, intermediaries, really throughout the field. And we offer a range of services and some products that really came from CDC leaders. When Success Measures was started, it was started because Community Development Corporation leaders around the country said, we're really tired of counting housing units. We've got to figure out what the difference we're really making in communities are. And they said, to do that, we need help. And so over the last 15 years or so, we've really evolved a set of products and services that help organizations throughout that whole evaluation cycle. My organization, Success Measures, sits in NeighborWorks America, which is a large congressionally chartered national nonprofit in the housing and affordable housing and community development field. And I wanted to just start because there are many ways of evaluating, and researching community development impacts. But our particular lens, and it comes from the fact that we were founded by CDCs, is that it really takes a village to do evaluation of community development impacts effectively. And that means that there has to be a participatory approach woven in so that you're involving residents, community development organization leaders, funders, stakeholders in a dialogue, that table that people talked about yesterday at our opening session, about what's important to measure and why. And then once you get that, here's what we're going to measure and here's how we're going to do it over time, to really be able then to involve people that you need to help you collect that data, analyze it, and then apply it to your programs. And then even later maybe become partners with researchers to go deeper and to tell even a bigger story. But first sort of working organization by organization. So let me see if I can, are the slides connected? Do you know? Let's see.
If you want to talk away, I'll load
Yeah,
it up.
okay, good. So I think that...
Oh, they are.
Yeah, okay, great. All right, thanks. All right, so let's see. I'm not able to get past the... Oh, here we go. Okay, good, thanks. So this is the question, right? Everyone wants to know, we've reached a point in the evolution of community development where we're really all wanting to know, how can we make a difference? And the nature of community development makes that really, really hard. In the last session, we talked about all the elements that go into community development. Well, that's what makes it really hard to measure. So it's no wonder that it's been a challenge. We're looking at change for people, for places, for economic and social conditions. We're looking at the interplay with government, the private sector, the nonprofit sector. We're looking at how all of those things can work together. And not one organization can ever claim credit for all of the work. So you really need to take a focus and think about whether you're going to look at changes in a place or changes for people. Another critical challenge has been that the methods of research and the academic community aren't always a good fit for neighborhoods. Some neighborhoods have been studied to death and really resist additional kind of external ways of collecting data. And then I think everyone has so many competing demands that the time and the resources and the money and the effort that you put on evaluation is just taking away, in many people's minds, the effort that you really want to be doing and making the change in your community. So those tensions are really real. And what we've done, I think, over the last, maybe 15 or 20 years, is come up with solutions. And we're really at an opportune moment because right now, data is not the problem. We have so many new ways of getting data. There are so many beautiful systems. The National Neighborhood Indicators Partnership that the Urban Institute has spawned in 35 cities has taken and gotten neighborhood down, or data down to the neighborhood level in ways, and mapping and the new technologies. We're hearing from Joe Kreisberg in Massachusetts, and they've done just a spectacular job in Massachusetts of taking work that the Boston Indicators Project and others have done and creating a new tool that really visualizes data in a way that you just can't imagine. You can get a piece of neighborhood data and you can begin to look at it, trend it over time. You can map it very easily. And those kinds of web-based platforms are really accelerating now. There are also some sort of just products out in the field. There's a well-known tool called Efforts to Outcomes that really helps people look at change for clients. There's a great new little mobile app called Local Data that you can go in and look at properties, photograph them, map them, and really begin to track sort of property conditions. And then we've developed a technology tool that really helps too. So the barriers that used to be there are really not there. And I think we're at a moment, if we can define what's important to measure, the field will really begin to take off in measurement. So Brad asked me to sort of say, well, what's one approach to doing it? And I want to start us with this sort of circle diagram that we use, which is the basic evaluation process. And this can go whether you're using secondary data, whether you're going to have a researcher come in and work with you, whether you're going to do the data collection yourself. But if you start with planning and really trying to figure out how to engage the stakeholders and the stakeholders that you need in your community to help you define what's most important to measure. It's not going to be everything that you do, because that would be an errand, way beyond what you could do. But really identify the most important core outcomes of your work. Then begin to figure out, well, how can I do that? We have a bunch of data collection tools in different types of tools that can help you do that. But there's also this wealth of data now in communities on secondary public and administrative data. Plan that data collection activity so that it's meaningful and works for your organization in with your planning cycles. And then mount the data collection effort. If you're going to do a field survey, that's one thing. It's another thing if you're going to start integrating data collection into the people that you serve as they come into your organization, and do that at intake and at different intervals, but really plan out that. Then, once you have your data, analysis isn't something that a student or an intern does. It really needs to go across the organization and begin to, somebody can pull the data, or a system can give you that analyzed piece of information, just like the great work that Rick was talking about, where eConsult, a consulting firm, took a look. But that data alone, if you don't then think about how to communicate it and use it. So we think of the evaluation cycle as being these 5 steps. People use them in very different ways. Some people do it in a very participatory way. Other people do it, more at the staff level and then engage their board and constituents in different ways. But I think it's a critical kind of piece, because once you are able to define for the organization and your community what you're going to measure and commit to it over time, it can really make a difference. So there are many ways to do it. One of the ways we do it is to go at the intersection points where people need assistance. So community development organizations are not survey developers or observation tool developers or spreadsheet developers necessarily. And so over time, we've collected about 250 designed or collected from leading organizations, data collection tools that we can offer in a library. And some are short, some are long. You can put them together. but you can go and find what you need so that you don't have to start from scratch, and they can be easily customized to your local context. And then, you know, when you are doing a strategic plan or anything else, sometimes it's helpful to have somebody help you get started and help you build your capacity. What we've seen is if organizations have a little bit of help at the beginning and are able to get through one evaluation cycle, they often don't need help moving forward. It really becomes a capacity that you have. And then some technology to help. So this is our Success Measures data system. And it's, you know, it's a very easy web-based system to use, and it offers these data collection tools, so surveys, focus groups, other kinds of tools, in 9 different categories right now. They're searchable: housing, community revitalization, community and resident engagement and resident leadership, how to measure the value or the outcomes of that, economic development, financial education and financial capability, some tools on green, resident services within a multifamily context, which also includes some supportive housing services, then another whole set sort of on the role of intermediaries, because that's a different kind of measurement if you're a state association or a city association. There's some other things about how you're helping build the capacity of organizations. And then we also take on the sort of development of new sets of tools. And so right now we're working on the intersection of health and housing and community development, as well as some additional tools in the resident leadership area. And then in addition to having that technology that sort of automates the evaluation cycle for you, one of the things that's really clear is people don't do evaluation every day. If your basic business is to do something else, but you come to evaluation every once in a while, it's really helpful to have kind of a library resource of exactly what you need to do when you go back to doing data collection. So people who subscribe to our data system also get this learning center that has a lot of sort of tip sheets and examples from other communities and things that will really help you define and use your evaluation process effectively. And so what does this look like in a community? So we've been really had the pleasure of working with the Wells Fargo Regional Foundation over the last 9 years and being a part of their theory of change and figuring out how to help them measure. And one thing that all the grantees in the Wells program do is at the planning stage of their neighborhood plan, they take the pulse of the community, taking a look at what resident quality of life, what are people's perceptions of the quality of life in the community, as well as looking at a number of other issues. And then working with the reinvestment fund, take a look at sort of the physical condition of properties, as well as getting a wealth of sort of community context data. So the neighborhood has, the secondary data they need, they have some look at the physical conditions, and then they take really the pulse of the community. And this organization in Northeast Philadelphia did that, and they had originally planned to do community engagement as well as some physical changes in their commercial strip. In the period between 2007 and 2009, it's probably not a surprise that they focused more on the community engagement and didn't move into the physical development over the time. But in those 2.5-year period, they found from their community engagement, working on the key issues that people really cared about, which were drug crime and other related issues kind of coming from that in youth development, that they had between a 14 and 28% gain in people's perception of quality of life. And that's really right before there was money invested in physical change. So what that led the organization to, so you say that's nice, it kind of makes the staff feel good, it makes the community feel good. You begin to get that positive dialogue going about our neighborhoods on the upswing. But it helped the organization say, we have to stay with community engagement. They made them really, really hold on and then develop some strategies that really did affect the physical conditions, both in taking back a park that had been a dramatic drug center, but then spilling off and really buoying the rest of their activities. We also so place-based measuring place-based change is really a focus of our work, but more recently we've also been working on the sort of resident services side and financial capability, and recently a set of organizations that were funded by the City Foundation to introduce financial coaching to their constituents. All used a common data collection tool pretty easily, learned how to integrate the data collection process into their coaching program at different points along the continuum, and then did a couple rounds of data and began to, as a group of these organizations across the country, say, well, what does it mean? And so, there was progress from coaching, but I think more important, and what the organizations really were excited about, was they learned from the evaluation process and integrating it in how to better tailor their services for each individual client, how to change their programs. Many people thought that people were dealing with credit card debt, and in fact it wasn't. It was student loan and medical debt, and there was credit card debt too, but really big issues. And they thought people were unbanked when they were banked, and people just changed their programs based on having that real-time information. And that's, we think about measuring it because we need to tell the story externally, but evaluation's key role is also to really help program development. So then I'll just leave you with this last piece, which is the figuring out how to communicate evaluation data is also really critical, and we spend a lot of time with our groups doing that. And people don't write long evaluation reports. They figure out how to have community meetings, house meetings, block events, sometimes parties and festivals, to communicate what they've learned, and that begins that dialogue of our community's on the upswing, but look what we found, this is still really a difficult problem. And it is the really important piece. And so these data collectors that went out and actually did a fantastic job on a project that NeighborWorks is doing, a community impact measurement project, came back and then created a festival. So the data collectors then became the action of how to get the message out. It wasn't originally planned, but they were so excited about what they'd done in the data collection process that they became really the engines of communicating it across the country.
Great, thank you, Maggie. Just before we turn it to Rick and Denise to get some of their reactions to that, I did have a couple of questions of clarification. Mm-hmm. The first was you mentioned that data is not the problem. The trick is to define what is important. But yet I don't remember speaking through you, and then you had this list of things that are important. Any thoughts on how you get to what's important?
Sure. So it's really a dialogue process. I mean, people start with, we have a kind of series of meeting processes that help people identify the programs that they're implementing, the key goals of their strategic plan if they have one, and then ask them what change they're seeing in the people that they're serving and the communities that they're working in. And that just generates a list, really. So instead of people evaluating their home ownership program or their housing development program, they say, people stable in their lives who have a safe place to live. That's the outcome. And so you really have to work through that process. There's not a shortcut to it.
Right.
And in some organizations, the youth are the issue. They may be doing housing development, but it may be focused in a very different way, and so they would be really focused on youth outcomes. So that engagement process, and if staff do it alone, they can get a pretty good list, but when community residents are engaged in that, that dialogue, you usually get a better evaluation plan.
Great. Well, after we hear... Yeah, let's dive in, because I'm really intrigued with this, what matters and says who. So, Rick, you're on deck, but first off, let's go ahead and introduce yourself and where you're from, and then have a question.
I'm Bernard Anderson. I'm from several places, I guess. I'm Professor Emeritus at the Wharton School. I'm also a Senior Associate at eConsult, and I'm a member of the advisory board for the organization headed by your next speaker, and sitting next to the senior person on the staff of that organization, that's PCAA. I want to push back a little bit, if I may, Ms. Grieve, on the notion that data is not important. Data is enormously important, and I'll tell you why. In the area of, I'm an economist, in the area of community development, we're talking about the allocation of scarce resources. That is fundamental. And that's one of the basic principles of economics, the allocation of scarce resources. And you're talking here largely about public resources, but also private resources in the case of foundation funding and so forth. And another notion that's important is return on investment. If you have a certain amount of money and you want to achieve a certain goal, you need to know whether you are allocating those scarce resources in a way that produces the highest return on the investment. And simply comparing before and after won't do it. It just won't do it. You need a research methodology that allows you not only to measure the change, but to determine what caused the change, what generated the change. Now, in much of the social science research now, there is the random selection. You compare a treatment group with a control group. You can't do that in this area. But what you can do is collect data and use mechanisms of research that allow you to determine whether the change that you observed was the change that was the maximum that you could have achieved by spending a certain amount of money to get that in. And so whether you're talking about small data or big data, you know, the current population survey, and all of these data sources that I know you are very well familiar with, it's important to get data in a way that measures the change and allows you also to determine what generated the change. Otherwise, you may be spending money and not getting the maximum return on your investment.
Maggie, you want to?
Yeah, sure. I don't think we actually disagree. I think it is a continuum, and I don't think I said data wasn't important.
What you actually said is data is not the problem.
Yeah. The
trick is to define what is important.
Yeah. So I think we have access now in ways to such high quality data that 15 years ago, 10 years ago even, wasn't possible. So and the work that we do with success measures is only one element of a really robust evaluation. So, you know, combining it with secondary data, taking a look at the level of contribution, but we do think that people who are in communities who can begin to collect quality data, and we use all the social science methods. We have people take random samples. We have them do very high quality response rates, and we run, you know, all the statistical tests on that data. But it is not a research study. It is evaluation. It's one community. And what happens then is those neighborhoods who are able to collect quality data over time could become fabulous research partners for people who come in. Just think if you touch the Wells Fargo Regional Foundations, who's been taking random sample surveys on quality of life throughout communities based on knowing exactly what program inputs they've had. They'd be a great partner for researchers.
Yeah, so Rick, let's get your take on this and what you're seeing with your membership and your reaction to what you've heard, both from Maggie as well as here.
Yeah, I guess I have a couple set of comments. One, just sort of what I like about the success measures tool is that, as Maggie pointed out, it sort of covers a wide range of work that CDCs do, and we know it is very challenging, whether it's housing, economic development, community building, you know, financial capacity, civic engagement. I mean, this is a broad range of work that CDCs are in, and you need sort of a comprehensive set of tools to be able to measure that. And it also, though, provides flexibility. So my understanding is there's sort of a core set of questions that you should be asking your community, but then if there's other localized needs that you want to try to measure or key issues, you can sort of add or modify that sample or that survey process to gather that information as well. And I really like that it does include sort of this resident perception survey. I think that's critically important. You know, if we really see our organizations rooted in the community, being community-based organizations, if we're not outreaching to the residents and finding out what they actually think and want to see in that community, that's a big missing piece. So I think that's critically important to the work. And I think a number of groups have seen that when they go knocking door to door to do these surveys, it also helps get those community members more engaged in other parts of the organization and community rebuilding process. So it's not just asking what they think one time, but it's sort of an entree into getting them more deeply engaged in the work of neighborhood revitalization. I also like the fact that most CDCs don't have a research team or a lot of in-house expertise when it comes to this. So the tools can help generate some quick reports that can provide some useful information. So that's important. You still need to have sort of the capacity to be able to analyze what that data means, but I think that's a critical part of the tool. And I think what also Maggie mentioned is that ideally this is not just a snapshot at one point in time. It's really a tool you can use to measure change in the neighborhood over time. And so if maybe you're doing an initial baseline survey when you first get your Wells Fargo grant, but you go back every 3 years or whatever to sort of capture both how residents' perceptions of their community and quality of life is changing, but also how on-the-ground conditions are changing. I think those are both critically important. The larger question around sort of the ideal state of where we'd like to be with this issue, I think part of it, increasingly, whether it's practitioners or funders, they sort of have drinking the Kool-Aid. They know evaluation and measurement is important, but I do think it's needed to further educate CDCs around what tools are available. I don't think everyone's fully familiar with these type of tools. And not just how you access the different data out there, but really how can you build capacity within organizations to use that data to then inform their work going forward, sort of like what you were saying. So how do you take the results and modify your current projects or programs, or in some cases maybe even shift some of the work that you're doing in the future to respond to the real needs that are out there in the community. I think another key issue, and not focus on success measures per se, but what we've seen with some funders overall is sometimes there's unrealistic expectations. It's one thing if you're getting 5 years or 10 years of support and you're going to measure outcomes over that time, but if someone's giving you a 1-year grant and you're expecting substantial change in that neighborhood that's been disinvested for 50 years, I mean, it's hard to show that short-term gain, and that's a real challenge. So we need to have funders have realistic expectations around what can be measured and what can be achieved in that short period of time, or either that or a willingness to provide longer-term support so that it can be measured over a more realistic time frame. And I think also, a lot of different funders have their own process, their own, own outcomes they want to see, their own formats. And it's a real challenge for CDCs to sort of juggle all these different reporting formats. And so there's a need to have a sort of a more consistent core set of measurements that everyone can agree on. So that I'm not uploading my housing counseling data to this funder in one format and I have to do it in a different way to another funder. So whether it's pulling some key pieces from success measures and getting a broader range of funders to agree to use those tools, or something along that line, but that's a key issue. We see a lot of members spending a lot of time sort of duplicative reporting in different formats around some of the same issues. And then finally, I think sort of the provision of adequate or dedicated resources to do this work. It's great that there's good tools in place. You guys have technical support and training and things like that. But it does take time and effort. You need people to go out and do the surveying. You need people to do the data entry. You need folks to do the analysis and then figure out how you're actually applying it to your work. And so there's not always adequate resources put towards that to make sure that organizations have the resources to carry that out.
Great. And I just want to make sure I'm clear on a takeaway, and then maybe we can get some input on that before getting a funder's perspective. But it sounds like you've put out on the table the whether and the what are not an issue with your members. It's the how. And so I just want to make sure we're clear on the state of play of the membership is that there is a good sense of what is impact and that we need to measure impact. The tricky part here is the tools and the funding to do so. Is that a fair statement? I'm just curious what people's reaction is to that.
There's a number of organizations in town that have been funded from Wells Fargo or have used the Success Measures Project, so there's some, some history there. I wouldn't say everyone's done that, so I'm not saying it's uniform across the board. And I do think sometimes there's, once you have your measurement data, there's different ways to interpret what that means. So, you can say you want to measure rising property values in a neighborhood. Some people think that's a really positive indication of a healthier, growing real estate market, that you're building equity for homeowners. Other folks might be concerned that you're pricing people out of the neighborhood. And so they might, while they might agree that's an important thing to measure, what their takeaway from it is going in different directions. So there needs to be more of an agreement around not only what we're measuring, but then how we're utilizing that information.
For those of you in the field, would you agree with this as the state of play right now? Or does anybody want to offer an alternative? Walter?
Sure. I have all kinds of thoughts because I was at an intermediary and I was tagged with evaluating our CDCs because I was the new staff member. And I asked if we had a budget so we could go to success measures or something, and I was told no. So we did our best to do it yourself, figure out how you measure things. And we could measure units, but when we came to measuring things like neighborhood engagement, the question was, well, do you measure how many meetings people go to? Is that the measurement? We don't think so. And so there's a lot of subtleties here, but I think I want to introduce an element here. CDCs are kind of at a profound crisis point, an inflection point of people versus place. And I love the word stakeholder, but I think it's a little bit disingenuous for all of us to use it because the stake is usually a bag of funding that person contributes to a business. They're stakeholders because they have a financial contribution. I mean, that's where the word comes from. We've extended to mean that anybody who lives in the neighborhood who will come to a meeting. And I would like to see, I think the CDCs need to figure out ways to make residents actual stakeholders, that they have some financial stake in improvements. And I know there are some innovations around that, some sort of ways for residents to buy and hold property in trust, that when it's developed they realize a financial benefit. But I think the most direct way right now is CDCs need to connect people to jobs, and CDCs typically don't know how to do that. So I guess my question is, I'd love to measure we talk about value add in education. I'd like to talk about the value add with CDCs and how they connect actual people to becoming stakeholders in the community instead of just people who happen to live there.
Anybody seen anything on value added metrics?
Quick add-on.
Yeah.
I just want to add on to. Hi everyone. I'm Dave Zuckerman. I'm with the Democracy Collaborative. We're a research center based at the University of Maryland, and I think that this tension of people versus place is a really important one, and that the metrics really need to capture for both. And I'm not super familiar with the metrics, all the metrics that were talked about in terms of what they're actually measuring, but we want to, the goals for people seem to really be new wealth creation and improved social networks, while for place, it's a stable neighborhood that's not having a lot of transient people moving in and out. So they're different, though, in terms of, because if you improve wealth for some people, they may move out. So it's really balancing those tensions. So I just want to add to that.
And where do you come out on that? How do you balance it?
Well, I think some ways.
Ultimately, somebody has to.
Right. I think in some ways you begin to balance it is that the residents have a stake in equity, but the community, in terms of an organization, has a stake in equity. And so you're balancing that tension through a shared equity process. So whether it's like the idea of a community land trust where the community retains control of some of the value of its land, and residents do that, or through other types of co-ownership models or whatever it may be, you're beginning to create real stakeholders over in different types of ways that all have a vested interest in the process. So, I mean, it's a long-term process. You've got to build the institution, the organization to do that, but however you can kind of bring more people to the table and all have them thinking in that same way. That would be my comment.
If you could hold that, I want to make sure we get Denise into the flow here, but I push on that because it does feel like even these things are happening implicitly, and the question is how do we make implicit balancing decisions explicit? And it does come down to this question of what matters and says who. And that's a good segue over to Denise, because in the earlier panel today we heard a little bit about, in the CDC world, it's too much of the funding tail wagging the CDC dog. And so I'd love to get your spin on this and how you're coming at it from a funding perspective.
Yeah, well, in terms of the regional foundation, again, we certainly provide the funding for the neighborhood revitalization plan. But in fact, it is the neighborhood's plan. It is not our plan. We are not dictating what needs to be done or what doesn't need to be done. And it is a collaborative effort with regards to the residents and the stakeholders in that community, whoever is defined as that. So whether it is the commercial business owners, the local houses of worship, the residents, the other nonprofit service agencies that are in that community, they are the ones that, in fact, create the plan, develop the plan, identify the goals and the priorities. And so it's at that level. So we're not saying that this has to be done with regards to that community. We are providing the support so that the community can, in fact, develop those goals. And I think it's very important that a planning process takes place because, in fact, in the very beginning of our neighborhood grants program, we had organizations coming up to us to say, well, we want you to support our expansion of affordable housing in this particular neighborhood. And then simultaneously, we have another organization, maybe 10 blocks away, saying, we want you to support our affordable housing expansion in this neighborhood, which, again, is just next door. And then the question was, well, how do you know that's what is needed in that community? And maybe that's coming from our banking background in terms of feasibility. The question was, well, we don't know that. That's where there's funding for affordable housing. That's why we're doing this. And so that is how we really developed the community-based or neighborhood-based planning. It wasn't that it's our plan, but we felt it really needs to be the community's plan. And therefore the funding comes along, but it's not dictating what that should be. And I wanted to just comment a bit on all the things that Rick mentioned in terms of what's needed that the data is there, but the need for training, for support, and for, again, looking at it long term. Those are the things that we've also incorporated in our planning process, that there is support in terms of resources, because we do know it takes a long time. It takes a lot of time. It takes money. And so we are willing to provide that support so that it can take place and that the capacity in terms of the staff to do this ongoing is there at the end of the process with us.
Just a quick follow-up on that, because I'm thinking of, is it Bernard? Yeah, Bernard's question before, because you talked about, as a regional funder, then you're looking to the community and you're looking to the CDC, I guess, to orchestrate the community. But then how do you then respond to making sure that it has a high ROI, even if it's not what's popular in the given community? Or is that a trade-off? Is that a false trade-off, or is that a trade-off?
Well, again, we're in this for the long term in most cases. So we are actually, we join forces in the very beginning to say this is what the goal is of this. of this particular initiative or, neighborhood revitalization plan. And we are buying into what those goals are. And we will monitor that. We will check in. We will work with. We will support throughout that process to see where we are over time. And, I guess ultimately make it a decision as whether that was a good investment or not. But that's important to us. That it's not necessarily, we're agreeing to those goals up front. And so, and in cases we may ask, well, maybe is that really realistic? In some cases where we have some goals that are very ambitious, because I think that's what they thought the funders wanted to see. And we say, we will pull back and say, this is really, there's a lot here. Can in fact you really do this in this period of time? So I don't know if that answers your or response to your question.
May I sharpen the question a bit? I'm not going to let you off the hook.
Okay.
You're a board member?
No. I wish I was a board member at Wells County. The Wells Fargo Foundation, right?
Regional Foundation.
What is the source of assets for the Wells Fargo Regional Foundation?
We have an endowment which was established at the time of the initiation of the foundation in 1998, and that is in fact the source of funding for our grant making.
But that endowment comes from assets of Wells Fargo Bank, is that right?
It came from in 1998. It was a one-time infusion.
Whenever it came from there,
Yes,
it
okay.
comes from a profit-making organization, a bank. Now,
Okay.
you can have a number of different programs. I used to be program director at the Rockefeller Foundation, and so I'm asking this question from that perspective as part of the diverse career I've been blessed to have. There are a number of program interests you might pursue at the Wells Fargo Foundation. You have chosen to pursue community development. Does the Wells Fargo Foundation also support arts and culture? Do you make grants to the Philadelphia Museum of Arts and the Barnes Foundation? I guess Barnes doesn't need it. They have enough on their own. But what about the Philadelphia Orchestra, the Black Pearl Orchestra, and these kinds of arts and non-community development organizations? Do you make grants to those organizations?
No, the Wells Fargo Regional Foundation does not.
Why do you not make grants to those organizations versus why community development?
Well, community development has been at the core of the Regional Foundation since its inception. And, I can share certainly a little bit of the history of the Regional Foundation. It was formed in 1998 at the time of a merger of two banking institutions in this city. The acquired bank, in fact, had a history of community development as a focus for their grant making.
One final question, because I don't want to take this.
Yeah.
One final question. Did the Community Reinvestment Act have anything to do with that?
I was not involved at that time. I do, in fact, know that, quite honestly, at this particular point in time, the Community Reinvestment Act does not affect the Wells Fargo Regional Foundation.
I see. And what is and the answer was
That is-
yes. What?
Yes, I was going to.
What I'm trying to draw from this is you are a foundation of a profit-making capitalistic organization.
No, we are a private foundation, independent 501c3.
All right, well,
its origins.
Moving on quickly here. So your point is, and therefore.
I'll let someone else.
Okay, good. So I would be curious to hear how some of the rest of you are processing this conversation, and in particular, some of our colleagues from the Federal Reserve Bank system here, where we've talked about figuring out what matters and to whom. In the what matters here, we're saying we need to get out into the communities to learn. How are people processing all of this? Yes. Oh, go in a different direction.
I My name is Peter OxHome. I work at Esperanza, and we have a neighborhood plan that's funded by the Wells Fargo Regional Foundation, and we've worked with success measures to measure our progress. And we measure, we did the baseline measure where we asked for how you like your neighborhood, why you moved here, if you had a chance to leave, would you, sort of crime data, education data. We did a really broad brush to kind of get a baseline of across a whole bunch of different areas and where the community is at, and then we'll measure again in 5 years. And sort of in between now, we're in our second year, in between now and then, we're just measuring really outputs, like the number of community meetings that we're having, the number of block captains that engage in block level revitalization, which is basically cleaning the block, painting the curbs, putting out planters. We'll measure the number of planters that went out in a year, things like that. And I guess the question of the tension between people and place is really interesting to me, because I sort of see this as a tension between like what we can have an impact on and what we can't. Where I sit, and I sort of had the community development division within Esperanza. Esperanza is a really large organization. It runs a charter school. It runs a junior college. It has immigration and legal services. I feel like I'm sort of balancing between what I can have an impact and then sort of trying to push back against these larger societal structural deficiencies or dysfunctions, like the school system, for example, that we can have just a small impact on, but not really a larger impact, but that if there was improvement, we would see huge change, right? Like if our school system in Philadelphia was actually educating kids and 95% of the kids were graduating, we would see a huge difference in our neighborhood. Esperanza runs a charter school, 95% of our kids graduate in 4 years. But we're starting to see slow change, but it's not the kind of change we would see if we didn't have to push back against these dysfunctional systems. So I'm wondering how what we're doing and the data that we're collecting at this sort of micro level can help us start to push back and change these dysfunctional systems that we are all operating within and have to eventually address if we're going to create this large-scale change that we want to create.
Any reactions for our panel?
It really is incremental over time. The more, but you might have to add some things that you're measuring. So, your charter school probably has a good set of metrics on not just graduation, but on student progress and the demographics, and to be able to compare that to the other schools' outcomes in either a comparable neighborhood could begin to tell the story of that charter school in a way that you could take to a policy level, but you're bringing data, on comparable families and comparable, time frames for students. Being able to expand the kind of perceptual data around what people think is important could also be an important part of a policy, aiming at the larger systems. So, maybe taking a look at the intersection points where the policies, and the systems that you're trying to change are, and just taking a look at whether you or people within your, the other organizations in the same community might be able to have a point of influence if you have just a little bit more data around either what people thought was the most critical, or you're armed with the education data or the youth development data or something else that would help you make your case.
I think it's an interesting question about not getting caught betwixt in between, and by betwixt in between being murky as to whether you're looking at the health of a neighborhood or the value added of the initiative. And I know in our organization, the Fund for Economic Future, working on regional economic competitiveness issues, we labor mightily to distinguish between those two things. And so we'll do an extensive amount of economic research about what is the state of the economy, but that's a separate conversation from what is the efficacy of the strategies that we're pursuing. But we do try to link them up at the end. And I worry a little bit about there may be confusion at the local level, is that when things are going well in the neighborhood, we'll take credit for everything that's great going on. But if they're struggling, well, our programs are going well and the neighborhood's struggling. I don't know that that's happening, but I could imagine that being a world where it does.
Yeah,
And so I guess the question is, or the follow-up is, to what degree is the CDC the steward of this place and the residents of it versus somebody who is an accelerator of particular strategies? And do we think about that in terms of measuring impact?
Well, I do think it's tricky in that there are larger forces out there beyond the control of a neighborhood or the CDC itself, whether it's the education system, which is clearly a big challenge, whether it's you're running a job training program and you're trying to measure the success of placing residents, but if the economy's tanked and there's not jobs available to put people into, I mean, there's a lot of outside influences that impact on the success of your work. I do think sort of measuring the success of what you're having in your community versus other similar communities that maybe don't have that intervention is one way to get at that. And your question earlier around how do you sort of take the information that the knowledge that you're creating there to influence public policy, I think is an important one. And we've certainly done that in the past by tapping into our members' experiences on the ground to try to address larger system change issues. And having that sort of local data, not just anecdotal, but the actual local data is really a key part of that process.
Other reactions and how you're processing this? Yeah.
So I'm Francisca Richter in the Cleveland Fed, and that's kind of part of the work that we do is try to find some objective ways to evaluate programs in order to tweak them, to suggest ways in which they can be better and share these across different communities. So I attended a few months ago a conference on from the Society of Research and Educational Effectiveness. So in the educational arena, and many of you might know about this already, some years ago they decided to pull this data, and I see kind of this as a starting process towards that goal, pull data that was consistent across the whole nation in order to be able to compare educational programs and evaluate them and see whether they were working, whether they were, so an education program that was starting in a place that was starting at a much more needy level than others, what is the value added? Things are not linear. You don't always have a percentage increase on a dollar spent. It depends a lot on where you start. So they, at the time of the conference, I think this was their third or fourth year that they are doing this conference, there's still a lot of struggle. So there's hope. I want to end with a positive. There's hope, but I think it's kind of like, if you're trying to be more objective, to capture data and use it in a more objective way, to look at before and after effects, difference in differences, I agree with all the methods that economists use that try to refine this are important, as well as the perceptions measure. My hope would be that eventually community development groups have that data available that has been pulled from administrative data. It's not just what we have in Ohio, in Cleveland, which is very wonderful, but it's more of a nationwide effort to capture this data and evaluate both perceptions and outcomes. I think we're headed in the right direction, though. So
Yeah, Brett, I would just add that in terms of even some of the work that we're doing with the various neighborhoods, collecting that data and even sharing it with other communities is something that's is very important as well. And to be able to have that kind of data with other organizations who are struggling with the same issues and perhaps getting different results. That is very important, and maybe even helping to move those issues at the higher level, or if they're having the same as results, and then saying, well, maybe there's something going on here, and maybe we need to take this further. So, just wanted to add that.
I'm Pat Morrissey from Hands Incorporated in Orange, New Jersey. Speaking of things that we can affect, I happen to believe that neighborhoods are changed by the independent actions of hundreds of people acting purely independently and that they make their decisions and take their actions based on their perception of where the neighborhood's headed. So in terms of measuring change and measuring impact, what are your thoughts about measuring people's changing perception and then measuring what sort of actions they are taking or contemplating taking based on that changing perception? So the idea is, if people perceive that the neighborhood's getting better, they make certain decisions. If they perceive the neighborhood's getting worse, they make other decisions. And, you know, it seems like that's real fertile ground for measuring the things that we can change. You know, putting aside the huge, you know, big economic shifts and school systems and, you know, industry moving out, for example, but the things that we can change. What are your thoughts on that as maybe some fertile ground?
So just to be clear, you're talking about almost a two-stage measurement?
Sure.
Attitudes,
Sure. How
yeah.
have your perceptions changed? What is your perception? How has it changed from before? And what have you done based on that
Yeah, how has it manifested?
changed perception? Your personal decisions.
Reactions?
Well, so we have some tools that do that because we agree with you, Pat. So asking, I mean, there are lots of different ways to ask people about their changing perceptions rather than you can follow them over time. You can say, you know, how do you think about this community as it was 3 years ago? How do you think about it 3 years going forward? We also have some tools that get at both individual and collective action. So one that actually came from the Rockefeller Foundation, it's called Capacity for Collective Action. And it asks people either in a focus group or in a survey to think about one thing that they did individually and one thing that they did with a group that they think had some change, and to help, and then there's a series of questions if it's a survey and other ways you ask it if it's a focus group, to say, what was behind that, and you know, what made it happen, and do you think that can happen again? So you just have to sort of put that evaluation together, both on the perceptions of what you think about the direction of the neighborhood and then the one about actions. And I think it's very powerful, and people have used it and you know, found that it's been helpful.
Did you have? Oh, sure. I'll go here, then here.
On a similar line of I'm sorry, Jim Burnett, Executive Director for West Philadelphia Financial Services Institution, and on a similar line of questioning, kind of anecdotal measurements, we had to relocate 30 families when we were building a shopping center. If I was to go and ask these 30 families, do they feel like they're better off now than when they were before? I guess part of my question is, they may not want to have that conversation with me again. Now, I think we did a pretty good job, and most of them will tell you we did, but they may not want to answer. So some of that data that you say that is not, we're not going to recapture that data, so to speak. But even if it's on the positive side, they still may not want to have this conversation with me again. And I could do a great job with that individual, and yet the community or the quote-unquote investment that Wells Fargo or anybody else is making, the numbers may show a broader amount that we weren't quote-unquote successful. So how do I deal with, from on a micro level, that I really actually did a good job for this family, who's in a much better position because now, in addition to having a 3-bedroom house, they got a 3-bedroom house that's generating income, versus if I look at the neighborhood as a whole, it still has vacancies all over it and yada, yada, yada. So how do I measure that or use that information from the individual level versus that macro level?
Yeah. Well, so there are really two questions there. One is you're asking about the change for the family. So if your design your key outcome in the relocation process was that the individual families end up in a situation that's equal or better, or that you want to see that there's a positive outcome for each family, that is an evaluation stream that you should follow. And it is hard to go back to people, but one of the things that the most successful organizations have done is figured out a way to communicate up front. So at the very beginning of the process to say, we really value how this turns out. Will you join with us so that we can help more people? Will you help us inform the work that goes forward, not just for you and your family, but for others? And if you approach it in a certain way, people have had pretty good success about being able to get back in touch with people. It's difficult. The biggest national research projects at the University of Michigan, spend a lot of money trying to track people down. But if you've got 30 people and you have that relationship with them and you say, I'm going to talk to you now and I'm going to ask you to answer these questions, and then I'm going to come back, and we're going to come back once or twice because we really want to know how to do this better and as well as we can for going on. You could probably get that data, but that's just one part of your data. Your other data is really, how is West Philadelphia doing? And then you have to look at what outcomes do you care about in West Philadelphia. Is it vacancy? Is it change in sort of people's perception of safety and ability to get the goods and services they need within West Philadelphia? Because if it was a shopping center, that's a key part of it. So you'd have to really think about those outcomes and then do really the same thing. Where would you get that data? Some of it's going to come from secondary data sources, the amount of sales within, and the economic impact of that piece. But the other part is going to be, are people's lives better because the shopping center is there and they don't have to travel, so there are tools that you could get at that. But they're really two pieces, and then you tell the whole story. My families are doing well in their new environment, and they're doing well in these ways. And the community has had these benefits, and there's still these problems.
I think one other factor, too, just as far as getting the families that relocated to respond, was who's asking the questions. Mm-hmm. And so in many cases with our members, it might be some staff, but it's also community leaders, mm-hmm. block captain leaders, or folks that are known in the community. They're actually the ones out there doing this, resident perception surveys. Mm-hmm. And there might be a greater level of trust, or mm-hmm. not thinking, oh, you're someone from the city or whatever. Right. And people might be a little bit more honest about their responses.
Yeah. And just to add on to that, in terms of our experience with the perception surveys, there are a number of organizations who went about this work and said, okay, these are the key issues that we think are important in this neighborhood and the perceptions that are out there. And once doing that, going through that perception survey with the residents in most times, I guess, really conducting that survey, having been trained in how to do it, there is a higher level of trust, because it's someone that you may have seen down the block, around the corner, that they in fact find out a whole different story of the perception of that community, that neighborhood, by the residents than what they thought. And they have in fact, Pat, in terms of some cases, made a change in their direction on their program, significantly so. They thought these were the issues to really to address. So I think it's a very important tool that I think that has been used and has been very productive.
Good morning. My name is Ken Stife. I'm from the University of Pennsylvania. My question is about funding and the willingness of a funder to fund innovation in evaluation. And I'll give you an example. So as Rick knows, in Philadelphia there's a renewed emphasis on equity in the face of growth, as certain neighborhoods have seen quite a resurgence. And one of the big tools, as you all know, in the arsenal for CDCs for trying to maintain equity in the face of growth is affordable housing. And we might want to know, if a neighborhood saw some real estate appreciation, did this affordable housing allow some folks to gain access to increased public services, amenities, etc.? This very much follows in the conversation of trying to evaluate place-based versus person-based outcomes. With a plethora of tools, indicators, open data, etc., it's easier now to evaluate place-based outcomes. But to evaluate this idea about people sorting in and out of neighborhoods and people getting access to certain neighborhood factors, this is evaluating people-based. And I'll tell you that there is projects here in Philadelphia and elsewhere where we have access to large administrative databases, similar to what Raj Chidi was talking about yesterday, where we can look at this sorting across neighborhoods. It's a very expensive process, as you can imagine, joining across these different tables, different databases, but we are seeing unprecedented glimpses into the process of neighborhood change and in issues of equity. And I'm just curious if your organization or other organizations have been interested in funding these sorts of evaluations, given the fact that dollar for dollar funding evaluation is probably not doing the best public good as opposed to funding affordable housing. Thanks.
Well, again, the Regional Foundation, we provide the sourcing and the funding for the evaluation of the neighborhood revitalization plans. We don't have an ability to fund other, just in terms of the other evaluation of other sorts of things. I don't know whether I've seen other funders stepping to the plate on that front. And even what we are supporting, we don't see other funders stepping to that plate in terms of supporting the evaluation aspect.
I was going to say that I think a big question for the field right now, especially given the conversations going on in Philadelphia, is how do you measure equitable development? Right. It's a newer concept. People don't even agree on the definition yet, and so what are you looking at? And as a first step in that process, we actually are working with some other folks with the reinvestment fund right now to look at incomes versus home sales in a neighborhood and how that diverges over time. So at least you can identify those communities where the trends are really shooting upwards in that respect, which will hopefully be used to inform public policy around what interventions make sense to enable long-term residents to be able to remain there and benefit from an improved quality of life. But it's a key issue, and hopefully there will be more funding out there to support that work because it's critical going forward.
So any early hypothesis on what might be the dimensions of measuring it? I'm
probably not the best to articulate this. Ira Goldstein would be much better, but they part of it is how people live in that community now, whether they can afford to stay there, but also people similar to me, whether they can afford to move there and take advantage of new opportunities that are being created or new access to amenities and all that. So I think what we're doing is looking at what the sort of income residence was at the initial baseline, say 2000, and then look at what home values have happened since then and how much that's departed and whether those long-term residents could afford to buy a home there, for example, now, or afford to pay a rent given what the current circumstances are or not. But it might influence whether our new land bank is disposing of property at, say, nominal consideration to support affordable housing or mixed income development in that community. Or, we've put some policies in place to help protect long-term homeowners so their property taxes don't shoot through the roof. But having that sort of data to back up those conversations, I think, is critical.
Where I was pondering on this one is it seems like there's probably a lot of evaluation tools and such that CDCs and such can be using to get at this, but it does beg, I think, a potential research question that may be something where the capabilities of the Federal Reserve banks and so forth might be able to illuminate the issue as well, and helping to define, well, what does success look like in terms of equitable growth in a neighborhood? Because what I'm hearing in this conversation is that there's a desire to do that, a desire to be metrics focused, that we can get our minds and arms around some place-based measures, but this people-based stuff is tough. But in terms of what really matters, it seems like the state of the art these days is to go out and ask the residents who are still here. I mean, that's what we've been talking about, is those that are left, we'll ask them and we'll baseline that over time. But that there may be this whole other area, which is, well, what are the kind of characteristics, the dashboard, as it were, of a neighborhood, and what do we know in terms of kind of what actually works?
Yeah. And I wouldn't want to leave, this conversation with saying that the going and asking the residents and the perceptions is really the only place. It's really a mixed method, right? It's the data that, the administrative and public data, it's thinking through the research questions, But, each of these have a really core pillar of what's needed if we're thinking about the broad community development field and how we're going to be able to tell a story at each level, both as we're trying to make change in a community, as we're trying to make change for groups of children or families, and then really the movement, and say this is the contribution that community development has been making in a city or wherever. Right now, we've been asked by a group of funders to work with the research director from LISC, Chris Walker, in Pittsburgh, to come up with a standard set of administrative and public data that LISC is really expert at tracking over time in the communities that they've worked in, and to come up with a set of perception and resident-focused community action kind of measures that the neighborhoods who want to participate in this citywide measurement could do. And then they have the great resources at University of Pittsburgh, Indicators Project, and they're going to really be the fuel for gathering that data. And then the researchers within the universities in Pittsburgh will be the kind of data analysts who communities can bring the questions to, and they can design the studies. But the data will be being gathered, the secondary data will be being looked at. And I think it's really an exciting model of the sort of marriage of all those pieces. And, I really congratulate the Pittsburgh funders for kind of conceiving it. We're playing a very small role, but it is a picture. I think 10 years from now, they will really have some interesting, because they're looking at the whole spectrum.
Well, we're coming up on the very end of this. If there's a burning question, we'll get it. Otherwise, I was thinking we might close. This has been a fascinating education for me and hopefully for all of you as well. Given that we have a conference app here, it struck me that maybe the appropriate way to wrap this up would be to allow each of our panelists to craft the tweet that they hope you'll share. Sitting here, I don't know what tweets have been coming out in the room here, but just kind of as a final thought, I'm wondering, loosely limiting yourself to the 140 characters. Somebody's got a tweet out here?
Yeah, I'm waiting. What do they want us to do?
We got the fingers at the ready, but as we think about measuring impact in the CDCs looking ahead, what's the tweet that you hope that our colleagues here in the audience will be plucking through?
I'll put forward
Now, don't
one.
look surprised.
I'll put forward one. I think tries to capture what the conversation's been, but properly resourced metrics can help CDCs pursue appropriate strategies and demonstrate a strong return on investment.
Hashtag Rick Sauer rocks.
Properly resourced metrics can help CDCs pursue appropriate strategies and demonstrate a strong return on investment.
You got one, Denise?
Okay, well, no, not really, but I would just say I think the metrics measurement, it puts everyone on the same page in terms of knowing what to expect, what to hope for, and what to work towards.
And I'd say CDCs who develop the capacity to effectively measure change, strengthen their organizations, communities, and the field.
Any from the audience?
I have one.
Okay, you're going to wrap us up with the final tweet.
Don't let complexity stop you from trying.
Amen to that. That's good. Thank you, everybody. And lunch is. Thank you to our panel. Thank you very much.